Dr. Mark Woodall from Cascade Integrative Medicine, your local naturopath in Issaquah, Washington. We're continuing our series on the background of anxiety, and today is part 2. Is anxiety caused by hypocapnia or low CO2? Some of the symptoms that we can experience when we shift our breath include the following. 1, anxiety, maybe dizziness, palpitations, feeling like you can't get a full breath. You might have cold hands and cold feet, tension in your shoulders, in your jaw, poor digestion. These are just a handful of questions that are part of a questionnaire called the Nijmegen questionnaire, which is developed in Sweden to assess breathing pattern disorders so that we can use breath to normalize symptoms in the body. Obviously, lots of the symptoms that I just rattled off may be caused by other things, and you should check with your naturopath or myself to make sure that it's not from a pathology, but changes in CO2 can cause every single one of those symptoms that I just talked about. And generally, people with anxiety have higher scores and improve when we shift their breathing. You see, most people don't know this, but your breathing is actually controlled by CO2. Your brain is more sensitive to CO2 than oxygen. I can prove this in one simple analogy. When you're exercising, you're actually producing lots of CO2 in your cells and in your blood, creating an acidic environment. And that stimulates your brain respiration centers for you to breathe off those gases. Right before you take a big underwater swim across the pool, what do people do? They hyperventilate to drop their CO2 levels. Now, if we do this in an acute or a chronic state, where we're constantly shifting our CO2 and oxygen levels, we can produce these symptoms, which restrict blood flow to our brain and prevent oxygen from releasing itself to tissues. And this is called the Bohr effect. If you're experiencing anxiety or any of the symptoms that other doctors have been unable to figure out what the cause, you've got an MRI or you've gotten other lab tests done and they say, well, we don't know why you're feeling dizzy or other things like that. It might be because of this deficiency in CO2. If you'd like to explore this and learn how to restore this, please schedule an appointment with me. I'm Dr. Mark Woodall from Cascade Integrative Medicine. Thanks for taking the time to listen.